Farrier's role in working on a case or a case that involves a keratoma can differ from place to place. Our role here, the surgeon or the surgery team, I guess I should say, is comprised of usually a senior clinician, residents, sometimes junior house officers, and students. They are obviously involved in the intake of the horse, the whole surgery prep. They take radiographs to define where the keratoma is, and then they surgically extract that. The Farrier's role is to think ahead and then again provide stabilization post-surgery. So our role on the horse you saw earlier, the keratoma case, when that was initially presented, we obviously trimmed and shod the opposite foot with a full support shoe, preparing for the potential of contralateral limb laminitis. So that horse is shod with a shoe with a full pour of Equipack to recruit the frog and sole into load bearing, to hopefully take some stresses off the laminar interface and hopefully reduce our chances of succumbing to contralateral limb laminitis. Then that night prior to the surgery, again, everything's shaped and fit up. So the foot's trimmed, the foot's prepped, the shoes are shaped, the stabilizing plates are shaped, the pad's cut, the hospital plate is made. And then the next day during surgery, we go in. I usually go in after the surgery. Ellen, our intern, Farrier intern, obviously goes in, watches the surgery. We work together to apply the shoe, the Equipack for support, the hospital plate, and then the stabilizing plates that go across the area of resection. And then, at that point, we usually walk away and go see other cases, and then the surgery team will stay with the animal, make sure recovery goes well, bandages it, obviously gets it up, gets it to the stall, and continues to provide care for it. And then they'll change the bandage daily until they feel comfortable sending it home. And it goes home where the owner will bandage, and then our team of veterinarians that went out a couple times to recheck it and make sure everything was good, make sure the stabilizing plates were still well attached and providing the stability needed, and that everything was going well. And then obviously they stay in constant communication with the client until the time of recheck. And at that point, radiographs are taken to see how much foot the horse has. We take all those structures off, the stabilizing plates, the shoes, trim the feet, and then apply everything. And our surgery team, or our podiatry vet, Dr. Pleasant, obviously looks at the area that was resected, making sure that it's healing appropriately, debrides it a bit to clean it up and make sure everything is healthy, and to expose it to UV light and air, and then also allow it to be treated again with the tinctures of iodine. So it's a big team effort in managing a case like that. I certainly don't think a Farrier should do it alone. I certainly don't think a vet should do it alone. I think it takes a big team to do it. And so that team not only includes the vet and the Farrier, but also owner commitment, and then the owner's team at home to provide the environment for that horse, the daily or every other day or every third day bandage changes. It takes a lot of work to get an animal like that back on the right track. And for the surgery, obviously went well, but then it's the aftercare that is the bulk of the work. It relies on the owner and their team at home.